Welcome to Mental Health Out Loud, a new type of conversation where the editors of ADDitude talk with leading experts in the fields of ADHD and mental health about the topics of greatest concern. Today, we're talking about eating disorders, and we have an esteemed expert to help us understand what defines an eating disorder, how can we know if our children are secretly suffering with eating disorders, what are the underlying causes of eating disorders, and so much more. We are asking our expert, Dena Cabrera, the very questions that our readers have asked to get help for families right now. Dena is a clinical psychologist and certified eating disorder specialist with over 24 years of experience. She has a private practice in Anthem, Arizona, and she has previously served as president of the International Association of Eating Disorders Professionals. Before we start our conversation, I have just a few housekeeping items. Those of you tuned in to this live event may submit questions for Dena at any time by navigating to the text box under the video player. We will do our best to incorporate your questions into today's conversation. And if you support the work we're doing here at ADDitude, we encourage you to visit additudemag.com/subscribe and sign up for ADDitude magazine. Subscribe now and you will receive our just published winter issue featuring a holiday survival guide, a survey that our readers answered on kids' mental health, a feature on new digital therapies aimed at curbing ADHD symptoms, and more. So welcome, Dena, and thank you for joining ADDitude for this very important conversation on eating disorders. This might come as a surprise to many of our listeners, but eating disorders are not a behavioral issue. They're considered a mental illness, and girls with ADHD are particularly vulnerable. One study found that girls with ADHD were almost 4 times more likely to have an eating disorder than those without ADHD. So let's begin with the basics. What are the different types of common eating disorders, and how do these present differently in boys and girls?
Well, thank you, Carol. I appreciate being here and talking about this very important topic, something that I'm very passionate about, because it is true that eating disorders are a serious mental health issue, and they are really the second leading cause of death, only to opioid overdose. Not too long ago, it was actually the first leading cause of death. So it's important to understand that they're very complex and they're very serious in the sense that they are mental health issues, and they do range from what we would consider disordered eating to eating disorder. An eating disorder characterized by certain criteria would involve like anorexia, so those who have difficulties sustaining enough energy for what their body needs, so restricting a lot of their food, significant body image issues, fear of fat. Then we have those with bulimia who will compensate for their food intake, so they may binge a lot of food in a short amount of time, and then will compensate either through abuse, such as exercise or self-induced vomiting. There's other ways as well, such as laxative abuse. And then we have those with binge eating disorder, those who don't necessarily will compensate, but they'll eat a lot of food in a short amount of time. That's a loss of control, a lot of shame and embarrassment. So there might be a lot of secret eating. And then we have this other classified area called what we call ARFID. And these are the kids, could be adults too, that don't necessarily have body image issues or fear of weight gain or fat or that psychological issue to diet because they want to look different. It would be those kids who are avoidant of food because of textures, or they are afraid they may throw up, or they're not interested. They're just not interested in food. They don't have an appetite. And we see a lot of those adults and kids as well with ADHD. And we'll talk later about perhaps what stimulants can, in how stimulants can influence some of that lack of appetite.
So you mentioned disordered eating. How does an disorder differ from disordered eating? And is there a typical age of onset for either of these?
Yes, well, and there's various times through the developmental stages that we're more triggered, or individuals are more triggered for an eating disorder or disordered eating. And as you would imagine, would be these transitional times. So 12 to 13, we're seeing again, and it's actually getting younger. We're seeing it again around 17, 18, perhaps motherhood or adulthood, and then later in years. So there are various times of triggered onset. But honestly, I've seen kids younger and younger have eating disorders. I have an 8-year-old right now that I'm treating who is struggling with a lot of dysregulation with eating. So difficulties being satiated, constantly thinking about food, mentally, upset and challenged with the way she looks. So there's various degrees. Disordered eating may not fit a criteria in what we classify as the DSM for, diagnosing eating disorders, but it's still just as mentally challenging because there's a lot of difficulties with esteem, self-worth, wanting to use food to change the way they look, or avoiding food, or using food to cope. So nobody sometimes sees that on the inside, the mental torture that they go through of thinking about food or hating themselves or wanting to hide food and then eat it secretly. So a lot of things we may not see, but they're still just as dangerous and still a psychological toll.
So that brings me to the next question, which is, what are the warning signs in the very beginning of an eating disorder that a parent or a teacher might overlook?
Yes. So the first thing that I always tell, particularly teachers or, adults, is we'll see, perhaps mood changes. You might see that they're either more anxious or they're depressed, or they have a change behaviorally, like in their homework. All of a sudden they were doing pretty well, and then all of a sudden you'll see a drop in their functioning at school, or they become more isolative. So those types of mood changes or behavior changes we might start to see first. Now that could attribute to a lot of different things, right? So then you start to look at, well, are there specific adherences to food or exercise schedules? Are they making excuses to not eat? Are you finding wrappers or food that has been secretly eating? So those are some more eating disorder behaviors. Rules, inflexible thinking. See a lot of inflexible thinking about food and dieting. And one of the main factors or consistent factors that we see that influence eating disorders is that first diet they go on. It's the dieting behaviors, the wanting to lose weight, and then getting reinforced and rewarded for perhaps losing weight. But then it takes it to the extreme. So these are some little things that you can look for. And certainly sometimes the best way parents can pick it up is by asking, how do you feel about, where you are? Are you balanced? Are you eating a variety of food? And we can get to that in just a little bit too.
How can caregivers know if decreased eating is due to stimulants, which, as you know, can act as an appetite suppressant, or if it's due to an eating disorder? And quite a few people have asked, can stimulant use lead to an eating disorder?
Yes, and this is probably the hardest question to answer because it's yes and no, because I really feel, as many of you know who understand and deal with ADHD every day, the medication can be extremely helpful, to bring down those regulatory systems, give them the dopamine that they need, and, kind of even them out a little bit, because the dopamine receptors, and this is a complex, system, right? One of the things that they need is to to regulate, and often food can be a regulator. So I say yes, and because for those who are really struggling with significant weight issues and they need restoration, we have to look at medical and nutritional stability first and make sure that they're in an appropriate weight. Now, if you layer that on overlaps with ADHD, we want to be careful with using stimulants with somebody who's underweight and malnourished and has difficulties eating because of lack of appetite. With that being said, if we're treating them simultaneously, we have to work with those difficulties with hunger and fullness cues, and they need the stimulant. We have to be able to work and be able to give them what they need despite hunger and fullness cues. So it gets a little complicated. So I'm very much for treating the ADHD, if appropriate for the individual, with stimulant medication, or to try a non-stimulant. And there's some other options as well. But we have to be careful about the weight and where the person is medically and nutritionally before we jump to a stimulant. Later in their treatment, if we are treating an eating disorder, I very much think that a stimulant might be needed, and we have to work with the individual on hunger, fullness cues, getting the nutrition that they need despite hunger, and being able to regulate their systems. So it gets a little complicated as I see, but I definitely think that you have to get somebody that understands ADHD and understands the eating disorder, because working with those two together, and especially if it involves the stimulant, is very important to modulate that.
So what drives eating disorders in teens and adolescents with ADHD? Is it about control? Is it about low self-esteem, body image? Or in the case of bulimia and binge eating, does it have to do with ADHD's weak self-regulation and impulsivity? Can you talk a little bit about those?
Sure. I think it's like all the above, right? So they are, eating disorders are definitely, there's a strong inheritance, it's a strong inherited predisposition in terms of a biologically based neurophysiological disorder. They do tend to run in families, but it doesn't mean like your mom or dad had an eating disorder. It could be, through, genetically. So that contributes to roughly 60% of the risk factor for an eating disorder. And then you have the other 50% that is environmentally influenced. And we're definitely in a culture that believes that thinner is better. It's very much about appearance ideal. It definitely can relate to low self-esteem and poor self-worth, and how we equate that, with if I'm just thin, then everything will be okay. So there is also a lot of focus on, what healthy is, and, certain, that visual that we have of what we constitute as healthy. And that's very confusing out in our culture, especially with all the food messages. And then we also are very judgmental. So there's a lot of comparison about, and that's where the perfectionism comes in, and, wanting to be, be approved by people, wanting to be liked. So I think all of that complicates the drive for an eating disorder, and it really sets somebody up, particularly if they have any kind of depression or anxiety. Oftentimes they turn to their bodies as wanting to fix that, and then everything would be okay. So it gets really complicated in that sense.
Mm-hmm.
I wanted to mention, sorry. Yes. I wanted to mention, you said something about, related to ADHD. Yes. There's, the theory of the habit, right? The dopamine reward, the cravings. If you've ever studied the neural system of food and that process, it's absolutely, mind-boggling. So there's a lot of reward processing and learning and memory, and the endocrine, the gut brain. So there's a lot that's involved. And food happens to be a way to deal with a lot of the symptoms or difficulties with ADHD. It could be a regulator. It could be something to do when I'm bored. It could be, it's the craving process, right? Of, getting something. And sometimes it's just the getting it. I'm not sure they like it, but they want it and they seek it. And that could be part of the ADHD system. So it tends to be an imbalance in all of that. And food happens to be something that they turn to help soothe them. And I don't know if it necessarily relaxes them, but it certainly gives them something to focus on. Mm-hmm. So it's a delicate balance in dealing with all of those different systems that are going on.
So how can caregivers and teachers identify and best address these underlying issues? And what are reasonable and appropriate supports at school for students with an eating disorder?
That's great. That's a great, and there's lots of resources, and I can mention that one that I'm starting to work with right now is called Be Real, and they're actually going into schools and talking to parents as well. But the first thing is we've got to shift this culture, the culture of thinner is better, more is better, being popular is better. We have to really get a shift to being your own unique self. And I know that sounds cliche, but we have to almost in the home get focused back on their integrity, who they are, where their values are, who they are as people, and really get back to unique, healthy, balanced self and attend to physical and mental health, not just academic or intellectual or performance. Really getting back to that regulation. I think the other cultural shift is instead of focusing on weight and measurement and our bodies as an ornament, we get focused back on our bodies as an instrument. Who we are is more important as a person than necessarily what we look like. I mean, it's great to decorate ourselves in a sense, but we also want to focus on what's really important. So that's another cultural shift. And then the other cultural shift would be not judging people by appearance, being careful of the way we talk about our own bodies, the way we talk about our food lifestyle. I knew a teacher that was glorifying and glamorizing her plant diet. And it was sending a message to the kids about, well, wow, that's really valued and that's really glamorized. And maybe I need to do that too. They're very impressionable at this age. So we need to focus more about accepting people at all sizes and shapes and being more about our integrity and who we are as people. So it's a big cultural shift in all of those. And that's what we can start with by not talking negatively about ourselves, not judging other people about their bodies, not saying comments like, oh my gosh, you lost 20 pounds, you look so good. Keep it off of our bodies. Talk about, I love your spirit and your smile. And well, I guess that's their bodies too, but the energy, your laugh, things that are more complimentary about them as people than about what they look like, and that's all. That's, I love to wear earrings and dress in pretty sweaters or what have you, but we don't want to continually focus on that. We want it to be about balance instead of weight.
Mm-hmm.
Yeah.
So we have quite a few questions from listeners regarding treatment.
Sure.
And we touched on this a little bit. So the first question is it necessary to treat a child's ADHD first before treating the eating disorder? And is stimulant medication safe to use when a person has an eating disorder? And I know you talked, if you could talk about that a little bit more.
Sure. So they both need to be addressed at the same time. That's hard to do because there's not a lot. I mean, we're in the infancy of really understanding and having research with eating disorders. And we're in the very, very infancy of eating disorders and ADHD. So we don't know a lot about it. But like you said, we do know that about 4 times in ADHD, you're 4 times as likely to have an eating disorder. So they definitely correlate, particularly with binge eating and bulimia. So think about that under controlled presentation, right? And food may be a way to regulate in a complicated way. But yes, you have to treat them both at the same time. And I definitely, and some people will disagree with me, that I really believe if you understand the ADHD, that sometimes stimulant medication may be necessary, but that doesn't mean that there's other sources of support. There's ways to help the child or the adult regulate. There's strategies and interventions that we need to put in place. So I definitely don't think that it's just a psychotropic medication and then, as you all know, then it's done. We have to really teach them about, this gets tricky, structure and support around food, but yet being careful not to create a feeling of being on a diet and being restricted, because then that evokes the food deprivation, right? So it's a big balance of, I want to give support and I want to give guidance around meal plans and having consistency, 3 meals a day, 2 or 3 snacks a day, and having some structure. Of course, we want the body to move. We want it, stress management, we want good sleep. All of those systems need to be in balance. And then we need to look at, okay, how does the medication fit with all this in keeping that structure and that consistency? But yes, they need to be treated at the same time. If they're malnourished, we need to be careful with the stimulant medication, because we need to make sure that they're in a medically and nutritionally safe place. Mm-hmm. So that's a long answer to, it's complicated. So, but the right person and the right team can help manage both of those.
Mm-hmm. When would it be considered unsafe to use stimulants in a person with an eating disorder? And in that case, what alternatives might be considered?
Well, when it's unsafe, it's when their weight is really compromised. And so they're medically and nutritionally, they're very compromised. I think that, and there's heart rate issues, there's, blood pressure labs are off. So we have medical evidence to show that we really need to get their weight and restoration and get them at a better place. I think those with, if they're abusing, obviously, the stimulant for weight loss, because that can be done as well. So I'm just going to take this and so that I can restrict and lose weight. I definitely think that's an issue. And so we have to look at the intention behind those with eating disorders on using stimulants. And that can be tough, because you really got to get to, what are you really using this? And are you eating regularly / normally throughout the day and consistently? So that could be an issue, that they can't abuse it. And the other thing is do we have a really good history and timeline that they truly have ADHD and they're not just using it for abuse? So those are some things to look for. But I'm also on the other side of, I know what it's like to have ADHD, and I know how that can impact their approach toward food and their abuse of food or their restriction of food. So it has to be delicately balanced. My son, I'll be very candid, he was on Vyvanse for many years, and then all of a sudden, his hunger fullness cues were impacted. And he didn't like it. He did not like being hungry all day. He had a really hard time eating during lunch, eating his snacks. So he would go all day, and we talked about how that's not healthy. He's not feeding his brain, certainly, obviously, his body. And so he had decided to go off of it and get his hunger and fullness cues back, because he really wanted that. Someone with an eating disorder may not want that. They like to be, it does help them lose weight. So we have to be careful about the intention behind using it. So he got off of it, and he's been able to do some other strategic skills, find out, of course he's older now, so it's been helpful to balance out his eating, but it took some time, and use other compensatory skills and strategies to deal with the ADHD. He's also not in school anymore, so that's helpful. But that was his choice, and that's what he wanted to do, but it was a challenge.
So that brings up an interesting point. How does it differ between girls and boys when it comes to eating disorders and knowing when you're hungry or not hungry, or the motivation to look well? I mean, are boys impacted in the same way? Maybe you could talk a little bit about that, because we usually do this in terms of girls and not necessarily boys.
Sure. And we're seeing a lot of boys. I have many boys in treatment, dealing with eating disorders and difficulties with food just in general, like that ARFID category I was talking about. And so it's interesting. The research shows that boys have a more focus, and this is true, to be bigger and muscular, but yet that pressure to be leaner. So there definitely could be more emphasis on I've got to be big and strong, but I also have to be cut and lean. And so we get that pressure to look bigger but not have any fat on them. So that gets a little tricky with boys. And there also tends to be more texture, like there could be more correlation with the ARFID part with the boys. There also tends to be an interesting, some research that shows that boys are more impacted by bullying as it relates to their weight. Not that girls aren't, but they are very impacted if there's bullying about weight, which tends to be oftentimes still accepted in schools. Like you can't bully about, well, not that they don't, but bully about like race but when it comes to weight, it doesn't seem to be as monitored. But just side note. But boys, I'll tell you, in our inpatient residential unit at Rosewood, the males are presenting very much like those with girls. Sometimes there's very little difference. And I think that's the stigma that boys face. They have a significant stigma that boys do not, or males do not, get eating disorders. And I'm telling you, in our inpatient residential unit, they're very much struggling with the same type of issues, which is perfectionism, low self-esteem, body image issues, significantly, hating their bodies, hating what they look like, not feeling good enough inside, and definitely a lot of food rules. So I have several boys that, other than gender, you would not be able to tell the difference because they're dealing with the same underlying issues. And I think that's really important to, for people to know that there is some differences. There might be a focus on bigger muscle, and there could be a whole body dysmorphia related to bigorexia is what they call it. But oftentimes there's not any difference. And I think that we need to recognize those issues, the weight stigma, the stigma in general related to eating disorders and who gets them.
Right. Mm-hmm. Yeah. This question is about recovery. How can parents try to ensure that a teen's recovery from an eating disorder will last? And maybe I should actually preface this by saying first, how do you know when a teen or a young adult needs professional help? And then how to ensure when they do get that help that the recovery will last?
That's a great question. I think, when definitely their function is impacted, right? School, social, academics, mood, you often will see a mood. from a growth chart perspective, it's when, if they're trending along in their growth chart in their percentile, you'll see a blip up or down. So you see either a drop or you'll see they go up, and because particularly we're supposed to be kind of following this growth curve, if you will. So you might see a variation, significant variation in that, see different mood. And so, or they're isolating and it's impacting their social health and their academic health. That's when you definitely need help. Because, with somebody who understands eating disorders, somebody who understands nutrition, we can get them back into a consistent, relationship with food, a healthy relationship with food, but also dealing with the skills that they need to regulate, being emotionally aware, self-compassion, inner values, connecting back to that, and definitely helping them with social, interpersonal skills. A lot of kids these days, and we'll maybe talk a little bit about social media, have a real difficult time. And there are really a lot of influences of social media, but I would definitely say in getting them into treatment, the sooner the better. Even if you're just like, it's a phase. It's like I said, the eating disorders are serious. Disordered eating is mentally torturing. And so getting them some help sooner the better is the recommendation. Even if it's just an evaluation, you think, I don't think this is too bad, but let me go get them evaluated because I want to make sure, because eating disorders are so serious. So that's kind of where I would start. And in terms of long-term recovery, I think when we see those three aspects, biologically, they're doing better. They're where they need to be in terms of I don't want to say weight, because I just don't want to judge it on weight or numbers, but I want to judge it on behavior patterns with food. I want to say that they're moving their bodies, that socially they're doing a little bit better, and certainly academic. They're back to what they love to do. Recovery can be a long-term thing. It could be, a process. It could be 2 to 3 years, but when you see them back engaging in their life, that's when you start to know that they're getting better and they're being consistent in their nutritional needs. I had I'll just tell a real quick story. I've had hundreds of patients, but one particular patient, I knew she was getting better when she started telling me all the drama that was happening at school and what she was doing on the weekends, and how she was going to go to this fall festival and this thing. And I knew that when she started to talk about other things in her life other than food, weight, and shape, that she was starting to re-engage. And those are some really significant indicators. They're re-engaging again. Yeah.
So it's safe to assume that males and females aren't really engaging when they're suffering with eating disorders. Does that mean they're mostly at home and not socializing because they don't feel great about themselves? And then
possibly, yeah.
Mm-hmm.
Yeah,
wow.
Definitely. They're not engaging. They're not, or they're going through the motions.
Mm-hmm.
They're going through the motions. And, but yes, I typically see a move toward, isolation, avoidance. And that is, a lot of indicative of the shame and pain that they're feeling. I mean, you will have a few that are engaging, but when you really talk to them and you really kind of get that sense, they'll tell you, I feel disconnected. I feel in my head all the time. And they're just not in the moment, and they just feel that there's a lot of loneliness.
Yeah. So Let's talk about social media a little bit more, which, as you know, has an outsized influence on tweens and teens. We've seen reports that teens and young adults are forming secret online communities to talk about eating disorders and crash diets, how to look skinny, ways to lose weight. If social media contributes to eating disorders, what can parents do, especially when it's not realistic to take away devices, to lessen the impact?
Sure. And then I think that's a great conversation. This is another, it's hard to tackle everything, right? But this is a serious, serious issue. So since the pandemic, just a few statistics, since the pandemic, the use of screen time is up about 17% for tweens and teens. And there are, just so everyone's aware, there are algorithms in our social media, the big tech companies that are targeting kids and tweens with eating disorder, pro eating disorder content. And it's pretty serious. So yes, in social media influences them to have disordered eating thoughts, to want to be a certain look, perfectionism. After looking at social media, this was the same with magazines years ago. People, individuals, kids feel worse about themselves and have lower self-esteem. It's all the comparison because they feel that they're not good enough and there's something always better. They're feeling left out and they're feeling like the world is, everybody's happier than I am. And that's of course an illusion and delusional. And so I think that's important that we're getting messages about eating disorders, pro eating disorders, just on their everyday Instagram, just on their everyday Snapchat, their advertising. I think there's another app. There's always another app, that the Be Real app, they're couching it into being more authentic. But at the end of the day, it's about, looking a certain way or capturing likes. I have one young person I work with who is just obsessed with the number of likes that they get and wanting to be perfect. And that certainly influences their eating disorder. So in terms of what can we do, I think they can certainly, get on board with some of the acts that are on, that are bills that we're trying to get passed. There's the Kids Online Safety Act. There's another, I think it's called it's called the Children and Teens Online Privacy Protection Act. We need to be talking to our senates and get parents be aware of the harmful content that their kids are looking at and they're being exposed to. It's dangerous. And I absolutely think we can absolutely reduce screen time and take away phones and limit what they're doing. There's lots of apps that could help. There's regulatories that you can help turn off their phones and get access to them. The phone is taken away at 8 o'clock or the Wi-Fi is turned off. And that's the expectation and the structure you set at home. But I don't think parents are aware of the dangers and the self-harm glorification or the depression and glorifying the depression and people seeing that and feeling like that. And it just perpetuates those issues.
Right. And these secret communities that are online, they have their own hashtags and their own language.
Mm-hmm.
So it's really difficult even for parents who are, knowledgeable and go online. It's really difficult for them to find that their kids are in these secret communities.
Yes, it is. Mm-hmm. Yeah, it's the inspiration. Oh, yeah. I'm sure everybody can relate. You shut down their social media and then they find a secret Instagram. They build a fake Instagram and then they have their real Instagram and then they have their personal Instagram. I mean, it's crazy. So yes, I do know, but there are secret groups out there that are couching themselves or masking themselves as being body aware, body positive, and they're really inspirations, or they're ways to lose weight, or they're ways to self-harm and not get away with it. These are real things that are happening. And, it's hard. Like I can, I've had my own struggles, but, taking away phones, making, if you're paying for the phone, I feel like you have access to the phone. And that's the rules, that I can look at your phone at any time and see what you're doing. They have ways of hiding it, though. The most important thing is, how do we sit down and talk? It's a real conversation with our kiddos about being aware of these stressors and being aware of how it makes them feel. And do we really want to feel like that after we're engaging in these groups and these talks? It's a whole conversation about relationships and toxic versus healthy when it comes to social media and when it comes to their friends too.
So how can parents have these conversations without judgment or without blame? Like maybe you could help us with some script, to start the conversation so that it doesn't sound, judgmental.
Right, judgmental, or yes, that's a great question, because, we don't want to come off at, like you said, judgmental or punitive or, mad. It really comes from a place of, I want to help understand, what is going on. Just a real open heart. And this is hard to do, right? Because your fear comes forward, right? Your worry, your anger might come forward, and they may feel that. So really trying to balance yourself and then go into the conversation of saying, help me, just really understand, how these friends may be influencing you, or, how can social media, like I've been learning a lot about how social media can impact mood or eating issues, and really just, coming from an open place of wanting to understand, and then really listening, trying to hold back the judgment and the wanting to fix it. I always kind of come from a place of trying to validate what they're feeling, and by identifying 3 ways to validate, like, wow, that must be really difficult, must be really sad because you really counted on that friend, and it sounds like she upset you, and you really value that friendship. So you think of 3 ways to validate your loved one in these conversations. But really just, opening up, and, sometimes in the car, finding that right place. Like sometimes I have them trapped in the car. That's an awesome place to sometimes talk about these sensitive issues. Laying down at night, because that's a more vulnerable time. They're winding down, and, being able to say, I've noticed, that you've, maybe, that you're, might be eating when you're bored, or that you've been upset more, that you haven't been eating as much, and I'm really worried about you. It's coming from a place of concern and support. How can I support you and understand a little more about what's going on so that we can talk about it? It's hard because shame comes up, pain comes up, and it's continuing to come from that place of, I want to be able to support you, and you're not doing anything wrong. I just want to be able to help you and get the help you need.
Mm-hmm.
That's most important. They're not doing anything wrong because they don't know. We want to really just, like I said, food and weight and body and appetite and satiation is so complicated. So it's not just about being disciplined or about, listening to my hunger, fullness cues, all that, especially with ADHD, is complicated.
Mm-hmm. We had a few questions around how to talk to children about their body imaging. So, for example, one mom said, "What do I say to my child when she says I'm fat? And she could benefit from losing a few pounds, but you don't want to cause her to become body conscious. You want her to be healthy, of course." So how do you talk to a child who might be overweight, but you don't want them to think that they need to be skinny?
Right. And I think that's a great question, because I want to just kind of look at the focus on weight. And the child is saying, I'm feeling fat, or maybe the mom is thinking, oh, there might be a weight issue. And that's where I kind of want to shift the culture a little bit, and take it off the number and the weight, and more about relationship with food and behavioral patterns and movement, and stress management. So the goal would not be focused on the weight. And of course, this is the first thing that doctors do, right? Oh, they're over there. They'll give you a BMI, which we could do a whole hour on BMI and the things that are wrong with it. But they'll give a BMI and say you're in this category, and maybe in the, overweight or weight. And we really want to take the focus off numbers and weight, and more on balance, variety, and moderation, right? And let the weight fall where it is. A lot of times it's our parents that might be more concerned about their child's weight than the child being concerned about their weight. Maybe. But the child is only going to be concerned about their weight if they're hearing it from outside people, and they're comparing, and they're getting valued because they're seeing others being valued for being smaller and thinner. So there's a lot of messaging about that. And I can't emphasize enough that we don't want to focus on weight, and the number on the scale. We want to focus on eating balanced, moving our bodies for the joy of moving our bodies, our self-esteem, and not comparing that their bodies come in all different sizes and shapes. And it's a real culture shift. And if my daughter said, I'm feeling fat, I want to lose weight, I would really, caution and say, let's not focus on the weight, honey. Let's focus on eating in balance and focusing on moving our bodies. And then in your head, you're kind of seeing, okay, how can I help her get more structured and more balanced? If she needs that, if they need that. Otherwise, we really talk about being healthy in our bodies, at all different types of sizes. Everybody comes in all different. There's a great book. Kathy Cater. Is it Children Come in All Bodies, or I think it's Children Come in All Sizes and Shapes, or All Bodies, but it's a great workbook. Kathy Cater, look her up. She'd be a good resource to help with these types of these struggles.
It's a huge shift to talk about eating healthfully versus losing weight, because
yes,
on weight. I mean, really, from the time a child is at the pediatrician's office and they're judged against other children in terms of their development. So it stays that way. So it'd be a huge shift in thinking.
It is a huge shift. And but if we focused on a healthy relationship with food, I mean, I'm making it sound easy. I know it's not easy, but if we focused on a healthy relationship with our bodies, movement, and food, and not focus on the weight, we're too weight, and there's arbitrary weights that we don't even know, really, if we're going to use a BMI scale or even a growth chart, sometimes it's arbitrary to what the body needs. And that's why I say BMI is a big problem. a lot of our athletes, because of their muscle mass, might be in the quote unquote obese section. And that's really not accurately reflecting who they are as an athlete and what their muscle mass is and what their weight is. So there's a lot of problems with using those measures. And I really urge people, shift the culture. Don't talk about your own bodies. Don't talk about others' bodies. Don't be judgmental toward others in the way they look. Your children are listening. And if you talk about yourself, then they're going to say, well, I look like my dad. So then, or mom, whatever, right? And therefore I must be, if they think they're fat, they're going to think I must be fat because I look a lot like my parents. So the messages are really important to shift. And again, get back to what's really important, the inner values. And all of what I'm saying, I know is countercultural. Like, I know this is countercultural. But this is, we're in a serious situation here with our kids' difficulties with resiliency, low self-esteem, and low self-worth. So we've got to do something different.
Mm-hmm. Exercise can figure prominently in teens and tweens with eating disorders. So can you share some strategies for setting boundaries around exercise that you've used in treatment, especially when exercise is part of a person's identity?
That is a great question. So yes, it can be a stress releaser and definitely an anxiety reducer. And it has to be with moderation, like I was talking about earlier. When exercise gets to a point of, it feels like again, we're looking at intent behind it. It feels like I have to do it. I'm doing it at the expense of my sleep, my time. It's causing significant issues with my relationships, which I see a lot. Like, people will exercise at the expense of spending time with their families, or some people who are so example of, if you're on vacation and everybody has to wait until, because they have to. It's all about the feeling of I have to. And the other part is perhaps there's stress fractures, or there's stress on the body, and there's a lot of injuries. So all of these together can be a factor. A lot of people are having osteoporosis or osteopenia, and so it really is compromising their body. Those are the factors that lead to the fact that exercise is becoming unhealthy, and there's no joy in it. That's why I like to use movement a lot. Moving your body. But a lot of people, yes, it's about anything, right? When on that dimension of over-involved, under-involved, or over-controlled and under-controlled, we're trying to get more to the middle so that exercise isn't a part, like I could leave it be for a little bit because I'm on vacation with my family and we're doing activities. It doesn't feel like I have to be, but when it's overtaking, I think it definitely causes more harm than good. It actually increases cortisol and stress, and actually could be, more harmful to the body if it's not done in balance. Mm-hmm. Now, there's those who don't move their body and don't exercise for many reasons. And I think that, again, is on the other end of the continuum, where we don't have to go to the gym and walk, 45 minutes or run 45 minutes on the treadmill to be an quote unquote exercise. There's so many different ways to move their body and feel good in their body. Playing Frisbee outside, taking a walk, doing Just Dance, or I think that's still a thing on Wii, or throwing the football around, just different things to engage, your body to feel good and be moving. So I think we have to get those definitions of what exercise constitutes out of our head and get back into trying to just get our bodies going.
Yeah. So I have a few friends whose daughters compulsively exercise, particularly if they've eaten, birthday cake at a friend's house, or so is there a way to talk about the obsessive part of exercising to lose weight or to not gain weight?
So those are the rules. So that's a rule around calories in, calories out, right? So that becomes focused on, I have to deserve or earn eating. And so it becomes an issue just in that sense. Like, I have to deserve to eat this cake, or I have to earn it by exercising, or, the calories off. So that's kind of where it gets a little disordered, because why can I just have a piece of cake because it's somebody's birthday? Why do I have to feel like I have to earn it or work it off? So there's that mentality around it, instead of, again, enjoying exercise for exercise because you want to be healthy and it's good for your heart and it's good for your stress and it's good for your body and your muscles. Not because I'm eating a food that is bad. And that's another issue I didn't mention. And maybe we'll talk about that next time, right? Nutrition, of having food be food and not labeling it good or bad. Because as soon as we have that quote unquote bad chocolate cake, then the internalization of I'm bad and I have to work it off becomes a cycle. And that's where the relationship with food becomes skewed or distorted or basically dysfunctional. Yeah.
One listener asks, does not being diagnosed with ADHD and eating disorders as a child make it likely that a person will carry these symptoms into adulthood?
I don't think necessarily. I think that, like I said, sooner the better to be treated and address these issues, because there's, people get better from eating disorders. People certainly improve from ADHD. There's, I think, different times in their lives where they're stressed and they, are different developmental periods in their life, transitions particularly, where they feel more stressed. And those symptoms, that way of coping, may rear its ugly head, like the eating disorder. So we have to be proactive and have preventative measures of taking care of your body. But I certainly absolutely believe, and seen it for myself, that people get better and can recover from eating disorders. And with ADHD, I certainly think that they can learn compensatory skills and their brain develops as they grow older, and they can learn different ways to cope. So I definitely think there's hope as someone gets better if they work it and realize that they have to work on these issues.
This is an interesting question. Do you have advice for parents with ADHD who are struggling with eating disorders themselves and who have children with ADHD and they don't want to pass this eating disorder onto them?
Yes. Yeah, I love that they such a desire, right? I don't want to pass these. Just exactly kind of what I've been talking about, changing the cultural shift in the family around food, learning other skills to cope instead of using food or avoiding food. And shifting about, focusing on self-care and focusing on that all bodies come in all different shapes and sizes. But it's all those shifts that I was talking about, starting with you, right? Like not wanting to pass those on because you want to change your mindset, and your approach to food will help definitely change their mindset and their approach to food.
So unfortunately, we're out of time, but Dena, thank you so much for being here today and for sharing your expertise with our community. And to everyone listening, thank you for joining us. The replay of today's conversation will be available on ADDitudeMag.com, and we'll email all registrants once the recording is up. We've had many questions from listeners about the nutritional aspect of eating disorders and how to help teens and tweens eat healthfully. Solutions are coming. In part 2 of this conversation with Dena, we will be joined by registered dietitian Megan Niskern, and we will answer your questions. And you'll love that their advice comes just before the Thanksgiving holiday. Join us on November 17th at 1 p.m. for part 2, How to Encourage Healthy Eating in Kids with Eating Disorders. We hope to see you then. Thank you.
Thank you.